People with diabetes are at double the risk of developing and dying from the cardiovascular disease like heart attack, heart failure, and stroke. What is it that we can really do? Because if I would have got this information beforehand, I don't think that I would have had such a extreme experience with diabetes and some of the underlying situation. What is it that people can do?
The biggest thing that people can do to prevent it is to make sure that your diabetes is well managed in the first place. Diabetes is one of those diseases that not only affects blood sugars as it's most common, but it is a microvascular disease. So think about what it's actually affecting. It's affecting those small blood vessels in your body. So where are they? They're in your heart, they're in your kidneys, they're behind your eyes, and they're in your brain. So what COVID also has been known to do is to affect some of those very organs. So you now have a double whammy. If you end up getting COVID and your blood sugars are not well controlled, you can become very sick. So our biggest thing that we tell our patients is to make sure that your blood sugars, your blood pressure are well controlled even before this. If they're controlled all the time, you're one up on COVID. So prevention is the biggest thing. Make sure that you're overall healthy, that you're taking good care of yourself overall.
But now, to be totally transparent, as a foodaholic, it is one of the hardest things in the world to do for me to balance my blood sugar levels and make sure my glucose levels are managed. I am so addicted to food, and with me, I classify it like this. It's like, excuse the coarseness of it, but I classify it like being a crack addict in a room full of crack. Because just about everything in our American culture, food-wise, has some kind of sugar content to it, and it for the majority of my eating, it is the wrong eating, has been, until I start changing. And then when I start changing, I start going through withdrawals. So I want to know, on a, how can I say this? On a practical tip for food junkies like me, what are some of the basic things that I can do to start the journey to this discipline, if you have that kind of advice?
Well, we teach our patients all the time to all things in moderation. There are few things that are completely off limits. One of the things that we absolutely tell our patients to give up is soda and those sweetie drinks, sweet teas, fruit punches, things like that. Sodas have got to go. They're horrible for you. But everything else in moderation is pretty much okay. It's not always what you eat, it's the amount of things that you eat that affect your blood sugar, as well as the timing of the day that you eat some of these things. So smaller portions, whole grains, more fruits and vegetables are key. We teach the plate method to a lot of our patients. So we advise them to do small portions of a protein or meat protein if that's what they like. So beef, chicken, fish. We also advise that they do whole grains such as whole grain breads and pastas and rice. Brown is better. And the other quarter of the plate should be, or half of your plate actually, should be your vegetables. Your raw vegetables are actually better, or steamed broccoli, asparagus, kale, collard, spinach, things like that. So it's a matter of getting a good combination or good balance of your food. That's probably most important. If you want a piece of cake on your grandkid's birthday every now and again, it's totally fine. You don't have to have the ice cream with it. Take the icing off. So you still get what you want, but you're not going to have elevated blood sugars because of that. So we just tell people to be careful and adjust where you can.
And really, that's the discipline I've started developing in the last couple of months, even through this COVID. I started learning how to maximize the foods that are good, that I like. And the things that I really have a penchant for, then you just maximize those things and take away the desire to go hunting for other things. But it's really a journey, and it took a lot of how can I say? It took a lot of damage before I started getting some good common sense. The damage to my eyes, damage to some of the neuropathies
Yes.
and the like, and still continuing to do wrongly until finally it just hit me. If I don't do something quickly, I'm going to do some irreparable damage that I can't bounce back from. And so that's when I started going into the real serious discipline of eating rightly, working out, making sure that I rest well, and the whole 9 yards. And Yolanda Adams told me to start taking little packets with me where I go. Little, if I like, because I like raw vegetables. So she said, just put them in a little baggie and take them with you wherever you go. And that's what I started doing and started becoming more accountable and responsible for my own maintenance, because it's easy to fall back into the bad practice of eating and to get lazy, especially in the job that I do, traveling as much. I did before this thing hit, traveling as much and using that as an excuse to eat badly.
It can be very, very difficult. And it's unfortunate, though, that sometimes it takes these bad complications for folk to wake up. And what my job is to try and prevent those bad things from happening in the first place. That's why we do what we do. That's why we have this clinic that we have, my sister and I. We really try and get on people before these things happen. It just doesn't have to be that way. You don't have to have blindness because of diabetes or heart attack or stroke or kidney disease. If we can prevent these things in the first place, we'd rather do that. The problem is that diabetes doesn't hurt. That's could be a good thing, could be a bad thing. Because diabetes doesn't hurt, our bodies aren't, or we're not more inclined to do something about it. If we've got pain, you're darn sure going to go to your doctor and see about it. But if nothing hurts you, you have more of an opportunity to ignore it, push it off. But that's when diabetes is doing most of its damage, and it can cause this heart disease that we talk so much about. So it's being knowledgeable on the forefront and being preventive is probably the most important thing that you can do.
For those people that are feeling some symptoms, because I'll say this: us black people,
Go ahead and
we
say it.
we will override and go past the point of acknowledging our sickness. We will continue on our daily drudgery and not pay attention to the warning signs. And thus, when we finally get to the doctor, it's on a stretcher in an ambulance.
Right.
And I want to be able to bring awareness to people, not to overlook certain symptoms. What are some of the things that are symptoms that people may have and just override?
So that's a good question. So particularly in terms of heart disease, if we're concerned about heart attack symptoms and things like that, some of the biggest warning signs that you want to look out for are chest pain. It's always the number one symptom. Shortness of breath, nausea, vomiting, dizziness. You can also get pain in different places. It doesn't always present at the center of the chest. Some people have belly pain or abdominal pain. Some people will have pain in their back or pain radiating down their arm or up their jaw. The thing I want to stress, though, is that because diabetic patients a lot of times will have nerve damage that we call neuropathy, and that's sometimes referred to as the burning and the tingling in your hands and in your feet. But if you think about it, you've got nerves all over your body, and you also have nerves that touch your heart. So think if your diabetes is not well controlled and it's affecting those nerves that touch your heart, you may not feel pain. The problem with that is, remember I said pain is actually getting us to go to the doctor. So we have a lot of our diabetic patients who have what we call silent MIs or silent heart attacks, meaning they don't have pain. They have some of the other symptoms maybe, but they don't put them together as thinking, well, maybe I need to get this checked out. This might be a heart attack, because they don't have that classic chest pain, because the diabetes not being controlled has damaged the nerves that tell their heart that it hurts. So that's one of the biggest things that we want to drive home. We want to make sure we focus on all of the symptoms, not just the chest pain, because some of our patients just don't have that. And in terms of stroke, we follow the acronym FAST, F-A-S-T. And some of those symptoms are going to be facial drooping is the F. A stands for arm weakness or numbness. S stands for slurred speech, and T stands for time to call 911. So if you have FAST, you need to be getting to the hospital as soon as possible because you may be having some symptoms of stroke.
But this kind of conversation that we're having right now is paramount. It is absolutely necessary because the what do we have, Tom? About 5 million listeners to the radio show, and the majority of them are African American or African because we're in Nigeria, or Bahamian because it's in Bahamas as well, or in London. We deal with this in an inordinate proportion. And I believe that these kind of conversations, Nurse Kim, is the thing that is going to really cause people on a practical level to pay attention to their own health and their own well-being. Because we don't have to die before our time. We really don't.
That's right. That's exactly right. And it really brings into focus some things. This COVID-19 really brings into focus disparities and some things that we need to work on. It's not just the fact that we as Black people are more susceptible to some of the comorbidities, but it also brings to light a lot of the social determinants of health. So it's not just taking care of our bodies that is important and really making sure that we have equity in healthcare, but it's really important to take a look at some of the social determinants. So do people have jobs? Do people have transportation? Do they have safe housing? Do they have health care? Is there funding for schools and for education? So all of these things impact particularly Black communities in terms of our health. They all go together. So it's impossible to talk about managing our diabetes better, managing heart disease better, without taking into consideration some of these other things. We've got to have that discussion. We've got to have that discussion together. And until we do that, we're still going to find these disparities and these gaps in healthcare. I just think it's really important that we have that conversation.
Kim, I thank you so much, Ms. Ketter. I thank you so much for just taking this time with us.
I really appreciate the time that you've allowed me to share my story and my passion for diabetes management and prevention and heart disease management and prevention. Thank you so much.
Kim, thank you so much, Ms. Ketter. I thank you so much.